The World Health Organization says the BA.2 Omicron subvariant is driving most global cases these days. Dr. Ryan Rivera is the Assistant Medical Director at Stanford's Emergency Department. First up, do you expect to see a surge in COVID-19 cases this spring due to the Omicron subvariant? If so, how serious do you think it could be, and how soon might we see it?
Yeah, well, overall, I think it is very likely that we will see another surge sometime in the next 6 months. I mean, COVID has not gone away. And as we've seen in Europe and parts of Africa right now, surges are still happening across the world. That said, it's quite possible that the BA.2 subvariant won't cause a surge in the US or in California in particular. Some of that is because in our latest Omicron surge, the BA.2 subvariant was already in the mix for us. That means that a lot of the local population already got it and has immunity to it. And that's going to put some downward pressure on any attempts for that to surge in our local area. That said, if it did happen, I would expect it to be fairly similar to our last Omicron surge, which is that it is very contagious. In fact, this subvariant's even more contagious than the Omicron version that was more prevalent in the last surge, but less severe than we've seen in the Alpha and the Delta variants. So, I'm cautiously optimistic this particular variant won't cause a surge, but I think we will definitely see some surge in the next several months.
And what is the scientific difference between a variant, a subvariant, and a mutation, and is one more concerning than another?
Yeah, so that's a good question. Viruses operate by infecting a healthy cell and then using its own machinery to replicate themselves. Now, this replication process is actually very complicated. There's tens of thousands of nodes in this RNA that are being replicated, and very often there are mistakes. Now, these mistakes are mutations. These mutations very often don't really cause any significant change to the virus, or they make the virus non-functional. But when those mutations cause a new version of the virus that is substantially different from previous versions, then we say that that's a variant. Now, those variants can then break off into subvariants of their own, usually through mutations. That's how you get the Omicron variant and then the BA.2 subvariant, which is very similar to Omicron, but has a few important differences. So that's the difference between all that terminology. I know it's kind of a little tough to keep straight. There's not necessarily anything that's more concerning about a variant or a subvariant. Either one, it really just depends on what's different about those strains.
Yeah, thanks for explaining that for us. Next up, a new study shows that a COVID infection could also raise the risk of developing type 2 diabetes. Tell us about that study, and if we've been infected, should we be paying closer attention to our blood sugar?
Yeah, it was a really interesting study. It was done through the VA, as I understand it, with thousands of patients, both in the study groups and in the control groups. And, it was very well done in the sense that, with that larger patient population, that's going to allow you to control for all the other factors that might, influence the differences that they saw. And they did see, I believe it was a 40 to 50% increase in rates of type 2 diabetes amongst those who got COVID. And that was true, even if it was a mild case or a more severe case. And so I think this is definitely something to pay attention to. Now, that said, this is one study done in one location with a very particular patient population. I would like to see it replicated in other areas with different types of patients before we say, we definitely need to do some type of large scale diabetes surveillance program. But it was a well-done study, and it's definitely something that we need to look into.
Something to pay attention to. And finally, when it comes to vaccines, do you think we may need to get regular booster shots like the flu shot, or is it maybe too early to tell right now?
I think it's very likely that we will need to get regular booster shots, very similar to the flu. I'm optimistic that it will, be something that is seasonal, that you can get once a year, something along those lines. But the frequency with which we'll need to get it remains to be seen. I think it is clear that we are going to, for a long time, maintain a large enough pool of patients with COVID across the world that it's going to continue to mutate, and we are going to continue to see new variants. But I'm also optimistic as our technology for creating new versions of the vaccine advances, that we'll be able to match up new boosters very well with those evolving variants, so that we'll be able to have good protection in the future.
Well, we definitely appreciate your optimism. Dr. Ryan Rivera with Stanford Healthcare, thank you so much.
Thanks so much for having me.